Mr. Michael Bird comes to us from New Mexico. Welcome. Mr. Bird has over 25 years of public health experience in the areas of medical social work, substance abuse prevention, health promotion and disease prevention, HIV/AIDS prevention, behavior health, and healthcare administration. Of his many accomplishments from 2000 to 2001, Mr. Bird was the first American Indian and the first social worker to receive as president of the American Public Health Association. He has also been involved in numerous health disparity projects and programs on a local, tribal, national, and international level. Most recently, he was named to serve on the Robert Wood Johnson Foundation Urban Indian Health Commission. Today, Mr. Bird will discuss the impact and necessity of diversity in the social work profession, of which is a living example. And welcome again.
Chairman McCarthy and members of the subcommittee, I'm pleased to be here with you today. As was mentioned, my name is Michael Bird, and I have over 25 years in social work in a variety of areas. Most notably, I was the first American Indian and the first social worker to serve as president of the American Public Health Association. I have been fortunate in many respects. Most notably, I also have a master's in public health, and I have found that the combination of the MSW and the MPH has served me well, served both my associations, and provides a unique perspective that I think has been relevant to the issues we're addressing today. Most importantly, we've mentioned some of the things, and I've mentioned some of the things I've accomplished, but I think more importantly to me is the fact that I'm from Santo Domingo and San Juan Pueblo. I'm a Pueblo Indian. My people have a documented history of being in the Southwest for anywhere from 30 to 40,000 years, with a unique culture, unique tradition, and unique language. That has shaped and forced and focused my whole personality and my experience. But I'm here today to talk about the importance and the role of diversity in social work. There really is a need to begin to really look at increasing the workforce and increasing a workforce that better serves the diverse population, the diversity of this country, but also increasing that workforce so that it better serves all of us. The social workers strive to ensure access to needed information, services, and resources, equality of opportunity, and meaningful participation in decision-making for all people. The profession is unique in that social workers are expected to understand different cultures and the function that culture plays in everyday life. They believe that strengths can be found in every culture and that building upon those strengths is the best way to help clients reach their full potential. The profession of social work values an understanding of differing political, religious, and ideological beliefs, and social workers are expected to respect the dignity and worth of each individual that they work with. Social workers are not only expected to understand the role that social diversity plays on society, but actively to work to end all forms of discrimination. The clients that social workers work with often are vulnerable and face prejudice and discrimination. Professional social workers support and advocate for recruitment, admissions, hiring, and retention efforts in social work programs and agencies to ensure diversity within the profession. They also seek to provide and advocate for the provision of information, referrals, and services in a language appropriate to the client. My career as a social worker and my background in public health have led me to a deep understanding of diversity issues in this country. Having worked to address health disparities with American Indian, Alaska Native, and Native Hawaiian communities, as well as all ethnic minority communities for over 25 years, has been a major area of my personal and professional body of work. This is a moral and spiritual issue and cries out to be addressed. It is also wasting our most important natural resource, our human capital and the nation's potential. As a U.S. Census report in 1970 chronicled, there are major differences in social, economic, political, and health conditions in the U.S. population. The federal report also identifies Latino and African American populations as having the lowest per capita income in the United States. And an argument can be made that Native Americans on reservations have lower per capita incomes but are not included in the federal studies. These statistics are unacceptable, and social workers are the professionals equipped with the tools and understanding to make a real difference in the lives of their clients. Although the profession of social work has a rich history of respecting and appreciating social diversity, it also has a historical tendency to attract Caucasian women to the field. While women have done an exceptional job of building a strong foundation of social service and strengthening individuals, families, and communities, we must look to the future, and that involves reevaluating our recruitment and retention techniques with a commitment to diversity. Another concern is that of the aging. Not only does social work serve the aging baby boomers, but there will be a significant need to recruit new social workers once the professionals begin to retire. When I reflect upon my career in social work and public health, I believe that what attracted me to this area was a simple desire to help others who might be confronted by something larger than themselves. As a child, I felt I had no control over my situation at home in growing up with an alcoholic father. This experience instilled in me a desire to help people gain some control in their lives. I also wanted to give them hope and a sense of direction. I also thought that only Indians had these kinds of problems. As I grew wiser, I came to understand that we all have problems, just different kinds of problems, and that we all need help now and again. Social workers made a critical difference in my life as they do in the lives of people every day. Thank you very much for this opportunity today.